Welcome to Experience Army Medicine Interviews. Our mission is to interview local medical professionals within the Army so they can detail their impact in medicine today.
My name is Captain David Gillenwaters. I'm a 66 Sierra or critical care nurse here at Madigan Army Medical Center. I was born and raised in Texas. I went to school in 5th Brigade ROTC down at Texas A&M University, Corpus Christi. I did my nursing school and under program there. When I commissioned, I went to Walter Reed National Military Medical Center for about 3 years and worked medical surgical. Went to the Army's ICU course and then came here to Madigan to work in the ICU. I have a family history that served in the military. My great-grandfather was a chaplain during World War II. My grandfather was a Navy corpsman before he got his commission, and then my uncle was in the Air Force as a fighter pilot. So as growing up as a kid, I was always interested in joining the military. And when I was in college, I learned about the nursing program, and it kind of clicked for me, and I realized that's how I can give back and serve. And so ROTC seemed like the right choice to make once I graduated and never looked back. A day in the life of an ICU nurse can mean different things. So in the Army, I have the privilege of working here at Madigan in the ICU, but I actually belong to the 10th Field Hospital out of Fort Carson, Colorado. So normally day to day, I work here in the ICU, but anytime my unit needs to go to the field or deploys, they ask me to go with them. So I get to train and play the Army part as well. And when I'm not out in the field, I'm here at Madigan working in the ICU and learning and growing my skills. There's a lot of education opportunities with being an ICU nurse and being in the Army Nursing Corps as a whole. So I've been able to attend multiple different trauma courses with some live tissue and hands-on training. There's also other courses that are geared more towards the field and operational side, whether that's learning to rappel out of helicopters or jump out of planes. There's a lot of training to do, not even just being a nurse. A lot of opportunities to grow your knowledge in the classroom and out in the field as well. The mentorship in the Army, I think, is very good, especially when you know where to look for it, kind of like in any big organization. In the Nurse Corps, you're fortunate that when you graduate nursing school and go to your first duty station, you're in a 6-month orientation program. So they assign you a set preceptor for 6 months to kind of learn what Army nursing is like. And that gives you the opportunity to see a more advanced officer further down your career path and ask them questions, get help with building your nursing skills, but also your officer skills as well. So I think the Army does a great job assigning that mentor in the beginning. And then as you grow your career and start to look around at the other opportunities and the other people you work with, you have that ability to network and get to know different people at different levels and ask all the questions you want and hopefully learn and pick a direction that you want to head in. I think the Army can be challenging at times, like any organization or any job that you work with, but something that you can't really find on the outside that I think is the most rewarding in the Army is just that ability to build that camaraderie and like that teamwork and to build those connections with people around you who are wearing the same uniform and doing the same thing and working for the same goal. I know when I deployed a year ago, my favorite part of that deployment was just getting to meet the LPNs and the combat medics and the doctors that I worked with in my hospital and just really building that camaraderie and learning from one another and taking that back to the States with me. I made really great friends on that deployment that I never would have met if the Army hadn't brought us together. And so that just camaraderie and unspoken bond is the best thing about being in the Army. I think the best advice that I could give for a prospective ICU nurse or nurse that wants to join the Army is don't be afraid to ask questions and always try something new. I found that the best experiences for me in the Army have been when I've stepped outside my comfort zone and asked to do something new or asked to go somewhere that I felt uncertain about initially, just because being able to grow and see new things that maybe if you stayed in your comfort zone you wouldn't get to do has just helped me grow exponentially as an officer, as a nurse, and as a person as well. So don't be afraid to ask questions and always try something new and just explore and take your career into your own hands and drive that the best you can.
Thank you for listening in on our Experience Army Medicine interviews. We hope that these interviews help encourage your own path into a healthcare career. If you enjoyed the interview, please don't forget to like, follow, and share our content as we continue to dive deeper into Army medicine. Be all you can be Army medicine.